be done for various issues such as alteration in bowel habits, onset of constipation, or any change in the size or blood in the stool. If they are having a lot of weight loss and they are complaining of a low back pain, all these are the reasons why they should undergo screening. And the onset of screening typically should start at the age 40 years. And if you look at our non-communicable disease control program, they recommend screening from the age of 30. And that, although recommended, we really do not have human capacity to do the screening on large scale right from age of 30. And women, especially over 40 years, they should be screened for cervical cancer, and pap smear should be conducted. And the incidence of cancer of prostate increases with age and it may be asymptomatic. And also, there is annual rectal or digital prostate examination which is recommended for all elderly men. They have to be cautious. And the vision, hearing, teeth, feet of the people affected periodically for various. Next slide. So, nearly 13.3 million cases they remain undiagnosed, and 50% of elderly in rural areas and 30% of elderly in urban areas invariably have certain disease not known to them or the family members. So, making screening more accessible and affordable is the challenge. Hopefully, the current health and wellness centers will play a role in the screening, and we call this as a iceberg phenomenon, or what is visible is only tip of the iceberg, and the larger portion of it remains hidden or submerged. The question is, whom do we screen? Because as I mentioned, the screening tools are not easily available for certain conditions. There are not adequately trained people, and also it costs money, certain investigations. So, whom to screen? Those people who are having hypertension, those who are in the habit of smoking, and women who have had gestational diabetes. They should ideally about age of 30. Next slide. So there are certain guidelines when it comes to nutrition for elderly. So the plant-based proteins are usually partial protein, and there are two different types of partial proteins which we consume commonly. Yeah, that's dal chawal. So it's a complementary one where there is cereal and pulses. So chawal is an example of cereals and pulses is the dal, and that is what we commonly consume Indian context. And intake of complex carbohydrates and fibers should be increased. There should be fiber rich diet which we have to encourage, especially among the elderly, to avoid constipation. Also, dietary fiber can also prevent certain types of colon cancer. So we should encourage intake of complex carbohydrates. Simple carbohydrates such as sugar and its derivatives must be avoided or consumed in moderation. And calcium and vitamin D in the form of milk, curd, cheese, or fish, and certain green leafy vegetables, they should be increased to compensate for changes which the elderly. Next slide, please. So, as I mentioned earlier, the salt intake should be limited, and certain food antioxidant property they protect elderly against certain cancers and degenerative disease are to be encouraged, and this is present in spinach, orange, sweet potatoes, and carrots, which are available in plenty. And additional supplementation of vitamins and micronutrients required in elderly, as there is higher risk of their deficiency. But normally in our diet, if we consume a balanced diet, there shouldn't be a deficiency of micronutrients specific. Next slide. So I would like to emphasize here on physical activity. I correlate physical activity with nutrition. That's because once the elderly are physically active, the metabolism likely to be maintained. I won't say it will increase all of a sudden, but at least it will give enough reason for them to build their appetite. And once the appetite is built, of course, they will be interested in food and nutrition. And as I mentioned, it's very important to have a muscle strength or the muscle mass. And sedentary lifestyle will not help in gaining that lean, lean, lean mass, what we refer to the muscle. Having fat is not helpful. Having muscle is very, very helpful, and we should not lose the muscles. Um, we have to maintain what is already there. Loss of muscle in old age is quite common, and this phenomenon is termed as sarcopenia.